Hello again, and welcome to Women's Health Issues, a channel that focuses mainly on health issues that affect women and how it can be treated, causes, symptoms, etc. So, in today's video, we will be focusing on, as you can see on the screen right there, abortion. Well, we all know abortion is a so-called taboo topic, but we are going to have to speak about it. So, what is an abortion and ways in which women go about getting an abortion? Okay, so what is an abortion? An abortion is a medical procedure to end a pregnancy. The procedure is performed in a hospital or by a doctor at a clinic. Okay, so that's basically it. The termination of a pregnancy. Okay, so how do they go about performing abortions? Okay, there are two main types of abortion procedures. Medication. Medicines can be taken that block certain hormones needed for pregnancy. They cause the uterus to expel the fetus on its own. So that's the first way in which an abortion is done, by medication. The next option is surgery. Different surgical techniques can be used to remove the fetus from the womb. The type of procedure your doctor recommends will depend on a number of factors, including how far along you are in your pregnancy. Now you might be wondering, why do women perform abortions? Well, the number one cause for abortion is practically an unintended pregnancy or unwanted pregnancies. Does an abortion hurt? Okay, let's discuss that. Many women experience some level of pain during an abortion. Women undergoing a medical abortion may have abdominal cramping that feels like strong menstrual cramps. Some women also experience diarrhea and nausea. Over-the-counter medications, including Tylenol and Advil or Motrin, can help with these cramps. A surgical abortion can also feel like strong menstrual cramps. During a surgical abortion, your doctor may give you an anesthetic injection called a paracervical block to numb the cervix, which is the area around the opening of your uterus. Call your doctor if you experience any of the following side effects after your abortion. If you experience a fever for more than 4 hours, heavy vaginal bleeding, which is normally bleeding through more than 2 sanitary pads per hour, severe abdominal or back pain, or if you have a foul smelling vaginal discharge. Few research studies have examined whether an abortion causes pain to the fetus. Limited evidence suggests that fetuses don't feel pain before the beginning of the third trimester, which is at 28 weeks or about 6 months. Can you have sex after an abortion? It takes a few weeks for the tissues of the uterus and cervix to heal after an abortion. While healing, those tissues may be more susceptible to infection. For this reason, doctors typically recommend waiting at least 2 to 3 weeks before having vaginal sex again. So if you have had an abortion, it is recommended to wait up to at least a month before having vaginal sex. Can you get pregnant after an abortion? Having an abortion usually doesn't affect your ability to get pregnant again. Some studies have suggested that abortion may increase the risk of preterm delivery in a subsequent pregnancy. Other studies have found no greater risk of giving birth prematurely. Abortion and mental health. Studies have found that in most women, having an abortion does not harm long-term mental health. Certain factors may increase a woman's risk of experiencing emotional distress following an abortion. These factors may include, but not limited to, having a mental health disorder prior to the abortion, lacking adequate social support from family or friends, being the victim of violence, abuse, or rape, having a negative attitude towards abortions, and ending a pregnancy because of a fetal abnormality. All right, so next we are going to talk about methods. There are several options for early pregnancy termination. Medical abortions involve taking certain medications as prescribed by a doctor to end your pregnancy. Surgical abortion procedure, different techniques can be used to remove the fetus from your womb. The type of abortion procedure your doctor or healthcare provider recommends will depend on a number of factors, including how far along you are in your pregnancy. With either type of abortion, you'll need an initial consultation with your healthcare provider who will perform the abortion. During the consultation with your doc, you'll receive a pregnancy test or ultrasound to confirm how far along your pregnancy is. You'll also learn about the potential risks and benefits of abortion. The other type is now medical abortion. A medical abortion involves taking 2 medicines to end your pregnancy. This type of abortion may be an option if you're still early in your first trimester, which is your first 12 weeks. The shorter the time a woman has become pregnant, the better a medical abortion will work. Some clinics even perform medical abortions at around 10 weeks of pregnancy. Medical abortions are about 97% effective. A small number of women will need a surgical procedure to remove the fetus if it isn't aborted using medications alone. 2 medications are typically given together in a medical abortion. The first of this medication is called Korlim. This drug blocks a hormone in your body called progesterone, which is important for maintaining your pregnancy. The other medication is called Psychotech. This drug comes as a tablet that can be taken orally or placed in your vagina. It causes your uterus to contract and empty itself. In a medical abortion, it may take 2 to 3 days from the time you take the first medication until all the fetal tissue has been expelled from your body. This method can be completed at your home. Side effects of a medical abortion may include fever, diarrhea, vomiting, nausea, headache, vaginal bleeding, cramps, or abdominal pain. The next option is surgical abortion. A surgical abortion is performed at a clinic or hospital. It can be done while you're under sedation or awake. You may receive a local anesthetic called paracervical block. It is basically an injection into your cervix to numb the nearby nerves. There are two types of cervical abortion procedures. MVA, which stands for manual vacuum aspiration. This procedure works best if your pregnancy is less than 12 weeks along. During an MVA, the doctor inserts a thin tube through the vagina and cervix into your uterus. A handheld device is then used to suction out the fetal tissue. The next type of surgical abortion procedure is called dilation and evacuation. During this procedure, you'll receive medicine to dilate or widen your cervix. The doctor will then use a number of surgical instruments to remove the tissue from your womb, such as forceps, scraping tool, and suction tool. Side effects of a surgical abortion may include vaginal bleeding, abdominal cramps, or abdominal pains. Partial birth abortion. The term partial birth abortion is used to refer to a procedure called intact dilation and extraction, or DNX. In this procedure, the cervix is dilated and the fetus is removed intact, which means it is removed as one. It is sometimes used to perform late-term abortions. So that is what we have to say about this topic, this taboo topic, abortion. So if you like our channel content, leave a like on this video, subscribe to our channel. The subscription link is in the description below the video. We also have other links to products that if you're interested, you can buy them. So until the next time, this is Women's Health Issues. See you all.